Hey, thank you again. Let me echo what Romney said. I do thank all of your employees for working tirelessly through the pandemic, and I really appreciate that. Ms. O'Connell, you're a Tulane grad. Congratulations on a great football season, top 10 Senates. That's really good. So let me say that. And Ms. O'Connell, we have witnesses on the second panel that are going to suggest drug pricing policies that they say would increase access to medical countermeasures. Now, I raise that because I hear from experts that medical countermeasure development is uniquely challenging, that many of these companies are small companies, that many of the companies that BARDA contracted with went bankrupt, and others got bought by bigger companies, and that bigger companies are getting out of medical countermeasures. Is that a fairly accurate depiction of the state of the play?
Senator Cassidy, thank you for that question, and thank you for the good wishes for the green wave. Appreciate that. We're very proud. It doesn't happen a lot. But to your question, the type of company that we have to work with are often small biotech companies because there isn't a commercial market for countermeasures typically. So we do have to work with the smaller companies that have to come in, are willing to be innovative in a certain way, willing to...
Can I stop you for a second? It's my impression that a lot of those companies are living on venture capital and actually have not turned a profit before their first big product. Again, is that a fair characterization?
We often support the work that they're doing in order for them to be able to be successful.
Now, if you were to put restrictions upon what medical countermeasure developed could be priced for, perhaps without knowing all the variables, and if they're, in this example, because I think it's a fair example, that there's really no secondary use, it's for this particular issue. Would that be encouraging of the financing, the private financing of these firms, or, if you will, discouraging?
Well, let me first say that we remain committed to making sure that any government-funded
I got limited time.
Countermeasures are available to people, to everyone in America that needs them. So we're very committed to that. But there is a risk if we were to add some limitations in the contracting that we limit the number of companies that are willing to come forward and do this work.
You would limit the number of companies, and the number of companies is already limited.
There's a risk.
Yeah. Dr. Califf, good to see you, man. You're looking fit, man. Let me just compliment you right off the bat. Another suggestion as regards how to develop some of these products is to incentivize innovation with an X Prize, a large sum of money, but that would be in lieu of patent and regulatory exclusivity. I don't know if you can comment on the finances of this, but do you think an X Prize would be an adequate substitute for one of these companies in lieu of the patent and regulatory exclusivity?
Well, you know what a complicated question you just asked. And what I'll say is the prices of drugs, innovative drugs, I believe are too high. But the solution to that problem shouldn't, in my view, be to do away with patents. They serve a vital role in stimulating the kind of thing you were just discussing. But where the balance is between those two and the role of prizes, that's a longer discussion. I don't think it's an either-or situation.
But in general, the intellectual property protection plays a critical role in incentivizing innovation.
Absolutely, and we just got sued today again by a company over that issue, so it's very important. If people are going to invest in these companies, there has to be intellectual property protection.
Ms. O'Connell, I'm going to ask you a question somewhat related to the last. There is a conversation about having what is called, quote, reasonable pricing, quote, clauses that would dictate the price of something should it enter into the commercial market. Now, in general, is there a commercial market for most of the things which BARDA is funding?
In general, there hasn't been. Of the 70 products that we've had licensed, very few of them are available on the commercial market.
Now, I think I have data showing that the NIH had reasonable pricing clauses from 1990 to 1995, and after they removed them, the amount of, here's the kind of production of drugs, and then they removed it and it took off. Now, that may be an association, not a causation, but in your sense, do you think that a reasonable pricing clause would make a company more or less willing to work with BARDA on medical countermeasures?
We'd have to take a look at that, but like I said, there would be a risk in adding an additional contracting element to the work that we're doing.
I have more questions, but I have no time. Thank y'all.
Well, the questions you raised are very interesting, and I look forward to discussing them.